Um, my name is Dr. Oyekan. I'm going to be your host for today, and we're going to be talking about hello, good evening to our viewers across the globe. My name is Dr. Oyekan. We are going to be talking about caring for our elderly parents today. And if you're just joining us, um, want to ask you to thank you for following us, for subscribing, and for being part of what we're doing. We're very grateful. Once again, my name is Dr. Oyekan. I'm your host for today. And if you've been following us in the course of this year, it's been a pleasure to host you. Our priority is to ensure that credible health information is made available to ordinary people in simple language. And we are also very grateful for you being part of this. We don't take the support lightly. We thank you once again. Yep. So yeah. Once again, I want to say thank you. I want to thank as many people who has joined us today. We're going to be talking about caring for our elderly parents, and it's been a pleasure to be your host. And we thank as many who have subscribed, who have shared our videos, who have left us a comment, and for those who have done us a favor of ensuring that our message go out. Today, we're going to be going further. In the course of this month, we'll be looking at the subject focus on Africa. And in doing that, we brought several experts from different specialty. We brought a renal physician, we brought a family physician, pediatricians, and geriatrician have all graced our platform to discuss the knowledge they have acquired in their various specialty and see how this knowledge can be made relevant to folks in Africa. So these are some of the things that we've been doing in the course of this month. So like we promised that we are going to be live every Thursday at 8 p.m. But unfortunately, our guest had a little issues that will keep her away. But however, our commitment to this program and to the ordinary people in Africa remains very focused. So in the light of that, we're going to be discussing the topic. My name is Dr. Oyekan. I'm a family physician, or what we call general practitioner here in the UK. I work with the College Health Group of Practice and also work at the Barking Avery University Urgent Treatment Center. And what we do basically, I also have a 2-year fellowship with Mid and South Essex with special interest in care of the elderly. So this is more of my specialty. So we're going to be talking about medication when it comes to the elderly age. And when we talk about elderly age, we all know that most of our parents, as they get older, sometimes they may possibly have 1 or 2 medical conditions that may require treatment. So in the light of that, you realize that sometimes you will have to be on some medications, and some of these medications are needed to be used regularly. And in order for you to stay healthy, we do sometimes strongly acknowledge that, advise that people stay compliant to this medication, ensure that they meet their physician as regularly as scheduled for review to ensure that sometimes, of course, some of these medications, as good as they are, they also need to be reviewed to ensure that you're using them appropriately and that you're not stepping out of boundary. Which is why we ensure that we're trying to advise that when this is happening, people should try as much as they can to ensure that they get to see their physician. Another thing we're going to be talking about when it comes to the elderly people is very important, something as important as mental state. Now, when it comes to now, due to the complexity of old age, it is also very possible that people with in the framework can sometimes express things like depression, because loneliness is also a very important part of the elderly phase of life, because sometimes some of these elderly parents may have lost their spouse. Sometimes it may be the wife that has gone first, or sometimes it could be the husband that has gone first. But sometimes, yeah, some of these relationships may have been built over 30, 40, 20 years or so. And losing that loved one sometimes may cause significant mental health impact. So, how do you manage this impact? One of the key ways of managing this impact is to ensure that we visit our physicians regularly and ensure that we have this credible with them. So this also will help to ensure that the support and the guidance you need, because they help to organize things like play date, like where you can get social interactions. Sometimes they help organize that so that life is not boring. And you know, one of the greatest weapons of significant deterioration in mental health is loneliness. And and if you have parents who have labored during their active days to ensure that you have the comfort and dignity that you're living right now, we also want to use this platform to advise that you reach out to them to ensure that you give them the necessary support that they strongly deserve. So this is not the time to isolate them. This is not the time to make them feel vulnerable. This is not the time to make sure that to make them feel that they could be a burden to you, because it comes with a lot of complexity. I know that it could be quite tough, but we advise that you take this quite serious. So one of the things that comes with mental old age is the sometimes multi comorbidity. By that I mean that sometimes when you see most of our elderly people, they may either have diabetes, hypertension, frailty, sometimes memory, cognitive impairment or memory impairment. All of that works into a single person that will make that person not to be able to function as effective as they should. So one of the things we advise is the fact that see your doctor and then ensure that you have adequate plans, either as family, because here in the UK, when people get into this group of, when people get into this phase of life, that sometimes could be carers arrangement that come to support them in their homes. And sometimes it could also be the fact that this care support could be available in somewhere like, you know, a care home, or in some cases where the complex needs are quite needs a daily oversight of a medical practitioner. They may be in somewhere like a nursing home, but wherever they may be, as we believe in the fact that families are supposed to create that support to ensure that the aging process for our elderly, or the later days of our elderly parents, are more enjoyable, tolerable, and more comforting. By comforting, this means that children support from the family and loved ones are adequate and complete and timely. So that's one of the stuff that we're going to be talking about. That's one of the things we're going to be talking about. So another thing that we are possibly going to also look at is when we talk about advanced care plan. This is one very important but necessary topic when it comes to caring for our elderly parents. because at a point where sometimes we all pray that our parents, we all grow old to the point that uh, we enjoy life, but sometimes that also comes with its own cost. That situations where um, you might not be able to make decisions for yourself. So, which is why we do strongly advise that it's also important that while your cognition is still absolutely intact, we do strongly recommend that sometimes it's advisable to appoint what we call a lasting power of attorney, somebody that has the ability to make decisions for you when you're not able to do it by yourself, or what we call advanced care plan. Advanced care plan can inform things like do not resuscitate, can inform things like peace document, we call it proactive advanced care plan, where you talk about what kind of treatment you want, where you want how you want to be handled in case life things are not as stable as they should. Or all of that are things that you can effectively discuss with your general practitioner or what we call GP here in the UK, so that the priority for you at that point is to ensure that your dignity as a human being is preserved and all of that is looked into. So, for here, there's a question on here that said, for the knowledge of menopause and the sign, it was helpful. Oh, thank you. I would just want to appreciate one of our viewers for giving us that comment that signs of menopause and the knowledge of menopause that we did last Thursday was absolutely helpful. We are grateful for getting such wonderful feedback, and we will convey this feedback to the key guests that helped in ensuring that that topic was adequately addressed. But we want to say that keep staying in touch. But more importantly, I just want to reiterate once again that I want to thank as many who have subscribed, who have watched our videos, who have left us a comments, who have shared our videos. We want our priority once again is to ensure that credible health information is made available and accessible to the ordinary people. As of today, we're streaming about few platforms. We're streaming live on Facebook, on Instagram, on YouTube, and our aim is to ensure that as many as possible can get this very vital information about aging. Now, in terms of support, like one more important thing I need to say, I beg your pardon, before we proceed is it always easy for some of our parents to accept that they're in need of help? Sometimes it's very difficult. I've been in a few situations where, especially daughters have been the ones who will bear the brunt when it comes to discussing the fact that our vulnerable parents are in need of support. One situation in particular where Parkinson's patient was rejecting care support, even trying to make a cup of tea, you notice the obvious terrible shaking, and the daughter was like that. Some of these things you might need carers to do this for you, and sometimes you feel this resistance from parent that they won't fight back and reject the thought of the fact that somebody might be thinking of trying to take their independence from them. So, but I think if it's done in such a way that parent understands that we're not trying to take away their independence, but a situation where they are struggling, in order for them to get the necessary support, we might need to put things around to enhance their continuous independence. So I think if it's put in a positive light that way, parents might decide to cope. Let me just continue in terms of because one of our priorities is to ensure that some of this message gets across to folks back in Africa, where the needs, there's significant shortage of health professionals when it comes to delivering the health service. But more importantly, our aim is to ensure that this information gets to them, they will be sure to do one or two important changes that can tilt their health trajectory in the right direction. So, well, like I said, that in Africa, you may not have a lot of care home, nursing home, hospice, and all of that, but back in the days, there should be a lot of structural support when it comes to family, where we have families and the family orientation brotherhood system in Africa, where people look after their aged ones. We will still encourage that, but with the advent of globalization, people moving across the globe in search of better lives, sometimes that leaves our vulnerable parents in a very pathetic state. So our priority is to ensure that whatever information we're able to get across, you can harness it and use it for the benefits of your parent. So I just want to once again appreciate as many who have liked our videos, who have shared our videos, who have left us comments. Like I said, that our aim is to ensure that we do as much as we can to improve access to credible health information. This month, our topic has been focused on Africa. We brought several experts from across the globe to come and share their experience and medical journey to enhance your health information. In the course of this month, we're still going to continue a few more. We're still going to discuss stroke, how to manage stroke, and what's the pathophysiology of stroke, how the stroke comes about. We're still going to discuss that. We're still going to discuss jaundice in children. Those are other topics. Those are some of the important topics we're going to be discussing. So we hope that you stay connected, stay with us, and please tell people about what we're doing and subscribe and follow us, so that the more we are able to reach more people, the credible it is for everyone first. So let's talk about another thing. Is talking about how to convey to our elderly parents that they need help. Like I said, that sometimes you have to be able to speak to medical professionals who are into care of the elderly, so that you can know the appropriate way to approach this subject. Because sometimes if you don't help them understand that it's things are not the way it used to be when they were 30, 40, 50, and that at 80 and 90, they are not as quick, they're not as fast, and they're not as stable. And you do it in a respectable and cultural mannered way. Sometimes our parents are very knowledgeable people, they may want or they may accept it. So these are some of the advice that we want to give in terms of helping our parents, because sometimes if you don't understand how to do this credibly, especially with close family bonds, the responsibility will fall back on you. And sometimes you have your own children, you have your own job, you have your own needs, and if it's not well managed, not just the elderly one can become vulnerable. Yourself as the primary carer too may be at risk of mental health breakdown, exhaustion, and it has many negative impact on your health as possible. To which is why we say that as important as this phase is, it's also very credible that we take it very serious. We take it. We try to make sure that things are managed properly. So we're still here, and then we still expect that questions will come in. Once again, we are on as many social media platforms as possible. We're on Facebook, we're on Instagram, we're on YouTube. We're also on X and also on LinkedIn. So follow us Leave us a comment, subscribe, tell us how we can improve, and tell us how best we're meeting your needs. And if there are any subject topic that you think that we might address best that will possibly speak to your need, we'll be delighted. So we'll feel honored to have that discussed. And once again, this was to fill in the role because our guest had an emergency appointment that had to reschedule this meeting for today. And we'll keep you in contact. We'll keep in touch as soon as we're able to get a more mutually agreed date for the talk on caring for our elderly parents. So it's from me and my team for the day. I want to say a very big thank you for those who have joined our live stream on all platforms, on Facebook, on Instagram, on YouTube. We're very grateful. So once again, my name is Dr. Oyekan. I'm a general practitioner here in the UK. I work with the College Health Group of Practice and I also work at the Barking University Urgent Treatment Center. So for tonight, I want to say thank you all for staying in touch and God bless you. Thank you. Yeah, so thank you for that question. I thought we was about to leave, but we still have time. This hour was originally meant for discussing. Say, how can we communicate with our parents about their health and when they have strong religious belief that God has healed them? Okay, I think that's very important. That when it comes to medicine and religion, I think they work hand in hand. That's one of the things we first need to clarify, that these two stream of thought are not isolated. Because if we help our parents to understand that the knowledge these doctors are using to treat their ailment is given to them by God, and that medicine itself has its origin in some of these strong beliefs that there is a maker that creates everyone for. So sometimes that might help to ensure that they don't see it as isolation, they don't see it as being combative, that the medication is trying to take the place of God. But I must say this with reservations, that even with the best of intentions, with the most skilled people, we still have a lot of people like the Jehovah's Witness, that regardless of how how well you want to present your case, they possibly will reject blood transfusion even at the cost of their life. So even with the best of intentions, there's a restraint that you might still meet some of these what we call strong ideological beliefs that might be difficult to surmount. But also there are also a set of people that believe that regardless of the importance of contraception, putting something in their body using contraception is absolutely prohibited by their religion. And they have as many children as possible, and which sometimes might be detrimental to their health and to the children, because the quality of care those children may receive might be suboptimal compared to somebody that have one or two children. But if we make our parents understand that the whole idea of medication, that this wisdom was given to these doctors by God to ensure that life is more enjoyable by the help of this knowledge, I think most of the reasonable ones will possibly want to accept that kind of rational discussion. But I must say that it must be done respectfully. It must be done in an environment of mutual love, concern, and understanding that they have held this belief for over 20, 70, 50, 80 years, and that sometimes those beliefs might be difficult to upturn. Because I have a patient that this was not even a religious belief, that 85, he was coughing and coughing, and I asked him, do you smoke? He said, yes. I said that by just giving up smoking, you will possibly improve the outcome of your coughing. And he was like, no, I've been smoking for the last 70 years. It's too late. I'd rather go to the grave with this stick of cigarette. And sometimes you look at it and like, he said, this is the only friend I have, cigarette. And we've been together for 70 years. So, and it might be very difficult to convince them that as bad as their health is, that quitting smoking, because he said if we quit smoking, it will be lonely. He doesn't think that any other thing can take the place of smoking. So sometimes it's difficult. It's difficult, I must acknowledge. But overall, it's a debate worth starting. It's a discussion worth initiating. And sometimes with support, like I'm also a Christian, I believe in prayers. With prayers and understanding, you should be able to go past it and get credible and reasonable response and answers from them. But yeah, I want to once again thank as many who have supported us, who have left us their comments, and we will be closing for today. And I want to thank you for joining, for leaving us questions and answers, and for asking some of the right questions. I want to stay calm. Remember, let's stay connected. We'll be back same time next week. Thank you.